Well, let's speak with Dr. Safia Ojo. She's a family physician who definitely knows better. She joins us from our Abuja studio. Well, Dr. Safia, just how much has COVID-19 really changed the health-seeking behavior of Nigerians?
Thanks so much for having me. COVID-19, as we all know, is an ongoing pandemic that has resulted into a large death toll in several countries, including India. A lot of people, yes, when they present with COVID-19, we know we can have asymptomatic cases in which they don't come down with symptoms. And some we could have moderate to severe symptoms, which could require hospital care and adequate treatment. Some of the symptoms we know include cough, chest pain, difficulty in breathing, and loss of smell, which is known as anosmia. The health-seeking behavior of individuals differ in the country at large. One thing we should consider is there are factors that actually enables one to get adequate health care or not. Some of these factors include financial constraint. Some people want to go to the hospital when they are sick, but they don't have the money to go to the hospital because they will have to get a card, they will have to pay for some bills, pay for lab tests and all that. Some people don't go because of the COVID-19 pandemic, they may be diagnosed. They think they will be diagnosed of COVID-19 when they go to the hospital. So some of them just feel, let me go to the pharmacy or seek traditional healers while sick. At the end of the day, when they don't feel well, they now go to the hospital when the situation is worsened. So it depends. A lot of people should know that they should seek medical care when sick. With the era of COVID-19 now, a lot of patients have been lost to follow-up. So they don't seek a competent medical health care when sick. A lot of them just believe I can treat myself at home, I can just ask of some drugs from my friends and all that. So the health-seeking behavior is worsened by the pandemic, which also makes us not to be able to know the actual incidence of new cases, the new cases we are having. Because a lot of patients, we know they may be asymptomatic, which means they may not even have symptoms, but they can actually transmit to others, even without symptoms. So that shows that people should keep their distance, we should keep using our face masks and also hand washing. These things has to be continued. Because even talking about the vaccine, just less than 1% of the population has been vaccinated, which shows we still have a long way to go. So we can't even be talking of herd immunity, in which you have a large population vaccinated and there is a general immunity to the population. So now we can't even talk about that. Less than 1% vaccinated is just like a drop in the ocean. So I think people should go seek competent medical care. They should go to the hospital while sick, and they should make sure they are well diagnosed. They should carry out all the tests they need to carry, the essential tests, and the right diagnosis will be made and they'll be treated. You know, so a lot of things we need to do now is to make sure we continue, if you have relations that are sick, don't be afraid that when you go to the hospital, maybe you contract COVID-19. It's better to go wear your face mask, go to the hospital. A proper history will be taken, examination, and proper diagnosis. A lot of people have had some complications at home due to the fact that they don't go to the hospital. So their health-seeking behavior is not good. It's worsened by the COVID-19 pandemic.
I think it's vital, really, to stay on that point which you just made, that the pandemic may have just worsened people's health-seeking behavior. But I also feel it's important to define what the right health-seeking behavior is. Because, I mean, for people, it's different. Some have, you know, a local, for lack of a better term, perspective to these things. They go herbal sometimes. Some go, you know, different routes. So is there a standard health-seeking behavior that everybody should follow, or people should just go about whichever works for you?
There should be a standard when talking about healthcare seeking behavior, because most treatment made in the hospital is evidence-based over years. A patient is diagnosed and is well treated based on evidence. So I think people should learn that when they feel sick or they feel any dysfunction in the body, they should go to the hospital so that they can be properly tested, examined, and treated. That will go a long way in avoiding the complications, unnecessary complications which may arise from lack of adequate health care. So they should ensure they get proper treatment. They shouldn't think, some people may think, oh, it's spiritual. And yes, we're not really on spiritual part of illness, but you should go, let's do the medical aspects, then you pray. I know culture too has a lot way to, when we're talking about health-seeking behavior. Some people just believe when you have a particular illness, it's not normal, it cannot be cured in the hospital. I think people should go to the hospital and let them be examined, a proper history is taken, and the right diagnosis is made. This will prevent unnecessary death. So people should have a standard. A standard is that when you're sick, go to the hospital.
Right.
Don't think of going herbal. At the end of the day, complications may arise from herbal medications like liver failure, because the doses are not, people just give any amount of dose, not minding that it can affect some of the organs in the body.
Well, Dr. Safia Ojo, you've been on the field for years, so you definitely have seen these things. But we'd like to thank you so much for those thoughts on the program this evening, and we wish you the very best.
Thanks so much for having me.